Welcome, everyone, to the 2020 Virtual Academic Symposium and the Community Connections poster presentation. Take it away, Dr. Jan Murray Garcia.
Good morning, everyone. So good to have you all joining us. I'm going to introduce a relatively new member of our Betty Irene Moore School of Nursing community, our Dean, Dr. Stephen Kavanaugh.
Well, good morning, everybody. Thank you very much for joining us today. I'm delighted to be speaking to you from the Betty Irene Moore School of Nursing. Clearly, these are very challenging times for us. And I think now more than ever, community and how we work together is important. At the very heart of the Betty Irene Moore School is the notion that we will work very hard, tirelessly, in fact, to resolve issues of inequity, try to bring about quality and opportunity through everything we do. And so the opportunity for our students to work with communities in real life projects that are of concern to everybody is really at the very heart of everything the school wishes to be, a good community partners. And so I'm delighted here to be able to just launch this program. I know that so many of you work so very hard and put so many hours in that aren't documented to make these projects work. I'm delighted to be able to hear about them, but also many thank yous, of course, that this wouldn't happen if we didn't have the support of our community connections, all the folks who also value the work we do and value what the school can do to help. And as nurses, of course, we work very hard to find real solutions to real world problems, and we need so many good ones today. I must thank all the community mentors and all those wonderful folks who've helped us get to this day that may be unsung in the fullness of things, but without everybody's help, we wouldn't be here today. And so, Jan, thank you very much for allowing me just to have those few moments, and I look forward to listening to the posters. Thank you.
Great. Thank you, Dean Kavanaugh. Let me introduce our course, which is NRS, or Nursing 206 Community Connections. When the Betty Irene Moore School of Nursing began 10 years ago, actually, this is the 10th cohort, there was a need for an applied experience for the master's leadership students. And these are all registered nurses who came back to school to get their master's degree in leadership. The applied part of that experience is what you're going to witness today, at least the end results. 10 years ago, my colleague Deb Burkerjian partnered with me to create this course. Jerry Bigby was also part of that, Mary Lou de Leon Sainz, my colleague Carolina Apaso Verano, and then Debbie Ward. For the last 3 years, I've had the most stellar teaching fellows, teaching assistants one could imagine, Jennifer Holt, Dr. Jennifer Holt, actually, and Dr. Laura Lynn Taylor. So couldn't do this without them, and they will be hosting the 3 projects that they directly supervised. This is a year-long experience in systems level problem solving, systems level leadership. So this was not about designing health fairs in the sense of delivering direct service. This was about really taking a challenge organizations had and didn't have the staff or time, or maybe just needing a little extra push so that their mission could go forward more effectively. In partnering with community organizations and recruiting them, we made it clear that we were not looking for curricular material for our students. We were looking for opportunities to serve. And that's what we've done. Show up, UC Davis showing up in the community in ways dictated by the community, by these community organizations at their pace, with them defining the challenge or the problem students of 2 or 3 were going to address, and with the community defining the outcomes as well. So this is based on a framework of cultural humility, where students honor the expertise that resides in the community. love to say thank you to all of our community partners, and remind our fabulous students to thank their community preceptors by name at the end of their presentations, if you hadn't planned to do so. Many of them, including Sacramento Food Bank Family Services, we have been with for 10 years, Wellspring for 7 or 8 years. So we just really have been honored to be in relationship. And without further ado, I am going to go ahead and introduce the first Community Connections project. Excuse me. To window. Okay, our first students for the first project are Michelle Yang, Shael Prasad, and of course the Nadine I'm sorry. It went to the second one. So I'm gonna go back. Thank you so much for your patience. And Nicole Lira. Okay, Shael Prasad and Michelle Yang, thank you so much. Please go ahead, mighty women.
Good afternoon. Over the last year, we have examined barriers to mental health care. For our project, we worked with Her Health First. This organization was originally founded as the Birthing Project in 1988, with a mission to decrease infant mortality within Sacramento's African American community. In 1991, the organization was incorporated into the Center for Community Health and Well-Being. And today, the mission at Her Health First is to promote health equity for women in Sacramento County. They provide support programs that serve women of color during all stages of life. And these programs include Black Mothers United, Girls on the Rise, childbirth education, and college and career readiness. During the last year, we collaborated with Black Mothers United. This program provides services such as transportation, pregnancy coaching, monthly mommy mingle events, safe sleep education, and they provide referrals for pregnant African American mothers with a goal to reduce preterm labor and low birth weights in newborns.
One of the current challenges that Her Health First faces is a lack of referral and follow-up appointments for mental health services. African American women are at a higher risk for developing mental illness due to risk factors such as low income, poor health, multiple role strains, and the double minority status from race and gender. The goal was to identify barriers preventing pregnant mothers from seeking mental health services. The results will help gather information on how to increase the rate of mental health referrals and follow-up appointments within the Black Mothers United program. For this project, we did a mixed method study, which consisted of a focus group and a written survey. The focus group consisted of mothers who participated in the monthly Mommy Mingle at Her Health First. 13 mothers participated in a focus group where they openly shared their thoughts and experiences around mental health and the barriers they faced within their community. And then we gave out a written survey to mothers who weren't able to share their thoughts during the focus group and for mothers who were not able to attend the Mommy Mingle event. And a total of 22 mothers participated in the survey portion.
In our focus group results, we found 3 themes: lack of trust in mental health personnel or the mental health system, fear of judgment, and the belief that mental health is not helpful. As I go over our study results, I would like to first review our bar graph in the middle of our poster. On the left-hand side are the I statements that list reasons mothers did not or would not seek out mental health services. The statements are sorted from the lowest to the highest percentages. Now, I would like to draw your attention to the last 3 statements at the bottom that participants most identified with. 45% of participants agree that they did not want to talk to someone they did not know. 40% of participants agree that they worry what others may think or say about them if they use these services. And 31% of these participants agree that they need more information about mental health services. We shared the results of our study with the organization. There is still conversation about how to best address these barriers given the findings, but our group recommended that a list of African American mental health providers should be created for clients. More information about mental health care and services should be shared through educational handouts or at the Mommy Mingle meetings held every month, and offer mental health referrals to all clients. As we conclude our presentation, we would like to thank the Executive Director, Shannon Shaw, the Program Director, Kenya Fagbimi, the Associate Director, Yesenia Haddad, and the staff at Her Health First for their collaboration and their work serving these wonderful women. We would also like to thank Dr. Jan Marie Garcia, who has mentored us and provided us with so many resources throughout this project. Thank you again for these great learning experiences. Thank you.
Mute. Okay, everyone hear me? Are there any questions that folks have about this project? Anyone in our audience? Can I ask you all, Nicole, Shile, and Michelle, if there's anything you would want to do that you didn't get to do? These projects run from about late November to March, a little bit into the spring. But anything you would love to go back and do differently?
I think one thing, just due to, COVID-19, we weren't able to go back and meet with the administrative staff. So if we were able to sit down, have a meeting, kind of talk about our findings, and then maybe seeing if we could work on like an educational handout that could be given to all the mothers.
Mm-hmm. Mm-hmm. Very good. Anything else? I know there was one comment that surprised all of us in the class about the implications of going to mental health services and how that might affect moms' records regarding social services. Does somebody want to just mention that?
Yeah, so when during the focus group, well, we found that moms were very open to sharing their experiences, and one of the things they shared with us was they don't want to use mental health services because they're scared that if they're diagnosed, like if people find out that they have a mental illness, they'll take their children taken away from them, and that was a really profound statement for her to make. So we're really moved by that.
Really, really interesting. Really, really interesting. There's one more question we'll take. Any ideas on what caused lack of trust in mental health practitioners?
I can go ahead and answer that question. When we were doing the focus group, a lot of the stories that people shared with their previous experiences, they felt like providers who were not also African American didn't really understand the circumstances they were under. They talked about how they were honest, but they were not always very honest to describe everything that was going on in their life. And also that sometimes instead of hearing what the women had to say, they would just push medications at them instead of trying to figure out what was actually the problem bothering the mothers.
Mhm, mhm, mhm. Very good. Thank you so much. I will move forward with the next project. Thank you so much, Nicole, Shail, and Michelle. Thank you. Okay, next. Of course not. Next, we have students Erin King, Wendy Scott, and Nadine Fabreau Brown.
Hello, good afternoon. For the past 6 months, our group has worked closely with Sacramento Regional Conservation Corps, where we created a peer mentorship curriculum. To give you a brief background, according to the California Board of Education, over 48,000 California students dropped out of high school in 2018. Dropout rates were the highest among African Americans, Native Americans, Hispanics, and Latinos. The Sacramento Regional Conservation Corps, SRCC, is a nonprofit organization that helps young adults from high-risk environments, ages 18 to 25 years, through education, paid work experience, and job placement. The organization is funded by local and state government agencies, grants, and donations. SRCC has 2 tracks that participants can be enrolled in: a work training program and an education work training program. By partnering with John Muir Charter School, SRCC is able to help young adults work towards earning a high school diploma. Work training opportunities are established through local governments and private companies. One of the biggest challenges the SRCC encounters is retention. According to previous Betty Irene Moore School of Nursing graduates' extensive study, they found that attendance after orientation drops significantly after 30, 60, and 90 days. Reasons why this occurred were because of lack of transportation, childcare, financial instability, food insecurity, unstable housing, and a need for mentoring. Based on the previous nursing graduate study, one recommendation they had was to improve retention rates by establishing a mentorship program.
Sorry. We started the process of creating a mentorship program with a literature review, which showed mentorship programs to be more effective at the peer level for our target demographic. Peer mentorship was also found to be equally beneficial to the mentor, as they had the opportunity to review previously learned skills and experience the positive effects of helping others. We worked closely with SRCC's retention specialists to create a mentorship and leadership curriculum based on a review of literature, pre-existing mentorship programs, and specific needs of SRCC. We utilized framework from a published document entitled Training New Mentors, Effective Strategy for Providing Quality Youth Mentoring in Schools and Communities, and created an activity-based program that encompassed core qualities of effective mentorship. Both a facilitator guide and mentor training handbook was created by our team. The goal of the activity-based curriculum is to provide core members with various leadership skills and necessary tools to prepare them in becoming role models and serve as a foundation for future career advancements. The curriculum is built upon icebreaker activities encompassing the core qualities of an effective mentor, such as trust, collaboration, team building, communication, and listening skills.
In order to comply with social distancing orders surrounding COVID-19, we held a series of Zoom meetings with JB Ball, retention specialist, and Norma Naylor, SRCC director. Collaboratively, a curriculum implementation plan was established. Initially, it was recommended that the mentor and leadership training program be incorporated into the graduate career class program. Our team deliberated and Norma gave the approval to proceed with the second option, which was to offer the proposed mentorship and leadership curriculum to interested core members and provide paid incentive to qualified applicants for a formal peer mentor role. Given the current situation, implementation timeline is still to be determined. We also suggested that the core member survey be conducted to evaluate the program once it has been implemented. We had a very enriching experience working with the SRCC community. The work we accomplished emphasizes the value of cultural humility and the importance of listening. We came to SRCC equipped with a wealth of knowledge brought upon by our experiences as nurses and graduate students. However, the ultimate success of the project came from our ability to capitalize on the inherent strengths of SRCC, recognize challenges as identified by the community, and help formulate solutions aligned with their organization's goals. We were merely instruments to ensure that SRCC's vision for a mentorship program to help increase its retention rate becomes a reality. Once again, we thank Dr. Jan Marie Garcia, Dr. Jennifer Holt, Dr. Laura Lynn Taylor, and more importantly, our community mentors, Mr. J.B. Ball and Ms. Norma Naylor, for this amazing learning opportunity. At this time, we'd like to welcome any questions. Thank you.
Hey, Dr. Jen, you're muted.
Okay, question number 1 is from Everline Agugu. This is such a great program. What are your suggestions on how this program can be sustained and scaled up once implemented?
So to answer that question, and based on the literature review, evaluations after the implementation of the program was recommended. And that way feedback and ongoing dialogue can assist with being able to revamp the program as necessary and hopefully sustain the mentorship curriculum.
Can I ask you all, this is like a 2-step project. So last year you mentioned that students, Betty Irene Moore students did the first phase of this project and then recommended the project that you're working on. Were you in contact with last year's students?
No, fortunately enough, we had a copy of their project that we were able to review. They did highlight that mentorship was a recommendation by them. The one thing is, working with the community group, we needed to actually find out if that was something they were actually interested in participating in, and they we're actually very excited about the idea. But yeah, to directly answer your question, we were not in contact with the past cohort.
Great, but you certainly built on their work. And that's one thing I'd highlight about this course, is that it's not just that we were in relationship with organizations over, 3, 4, 5 years, but that a lot of these programs built on the program from the last year. And there was a very complicated handoff procedure, as Aaron said, that didn't necessarily require in-person talking with the students from last year. Other questions? There's a question, what's one way you could evaluate the efficacy of the mentor program? And then they say, ignore my question, it's on the poster. And can you describe how big the program is in the Sacramento region?
So the program itself is based on the orientation and how many students enroll. Their enrollment is between 5 people to 18 people per orientation. And they have had the orientation once a week. And then, so it's variable what the amount of people per the program, because it's continuous to get an actual number. But they have now had orientation once every 2 weeks. And so the hopes is with the orientation process and the ongoing established students create an actual role where they can apply for to be a mentor. So that way they can want to be a mentor and they get paid incentive for it. It's an actual pay raise.
Actually, in addition to that too, the Sacramento Regional Conservation Corps has different contracts to different employers within the region. So it also depends on how big of a job they're getting and how many clientels they get. And sometimes they would increase their recruitment based on the need of the clients that they support within the region.
Mm-hmm.
And also to add to that, they actually have members as far as like Woodland and Davis area, and they're actually located in South Sacramento. So they have pretty far reach.
Mm-hmm. There's a question from one of the students, Kim Jupe, who worked on the project last year. So she was one of our master's leadership students. She says, I was involved on last year's project, and it's so gratifying to see one of our recommendations will be implemented. When will it be implemented?
So currently, Ms. Norma Naylor is taking it for approval for the boards. And I think because of the social distancing and COVID-19, it's kind of on hold right now until all that clears up, but it's up for approval right now. And they told us they will actually get in touch with us once once it's implemented, so we can hopefully attend one of the sessions to actually see it happen.
Awesome. Okay, thank you all. Thanks, Erin and Wendy and Nadine. That was fabulous.
Thank you.
Mm-hmm.
Thank you.
Next up, working with Yes to College are Gina Nicole and Nicole Vance.
Good afternoon. We were partnered with the organization Yes to College, and we are presenting to you this organization's legacy of wellness. Yes to College is a nonprofit organization that was started by Sharon Chandler and Tony Colley-Perry that aims to provide real-time educational tools, resources, and connections to students and parents in the African American community in the Sacramento area.
To give some statistical information, the dropout rate for Sacramento County high schools is highest for African American students over any other student population. In 2017, the national percentage of 18 to 24-year-old African American students enrolled in college was 36.5%, yet the percentage of white students was 41%. The underrepresentation of minorities in healthcare has also been linked to worse access and outcomes for minority groups compared to their non-minority counterparts.
Yes to College's mission includes improving community health and wellness, and to aspire to higher educational opportunities and health careers to assure African Americans receive culturally competent care. Yes to College is an education pipeline for youth and young adults and has 3 programs. The African American Women's Health Legacy Program, which strives to help reduce type 2 diabetes, hypertension, and obesity through education and awareness. The Minority Health Professions Mentor Program, which strives to increase high school graduation rates, increase knowledge and exposure to future academic and professional options through summer job shadowing, and the Saturday Scholars Academy. That is a program for middle and high school students and parents focusing on early college prep, goal setting, networking skills, high school graduation, and early career and college exploration skills.
Our project was to create a preliminary legacy report of testimonials and interviews with program stakeholders and recipients of Yes to College's 3 programs that highlight the community work of this organization. In our process of creating this report, we conducted interviews, reviewed post-event evaluations, and attended Yes to College events. The purpose of a legacy report is to serve as a contribution to future generations, to use as a marketing tool for partners or potential donors, and to honor the community work accomplished by this organization. We identified themes from our interviews and evaluations, themes of networking, mentorship, a legacy of wellness, exposure to different opportunities, a vision for youth, achieving health equity and eliminating disparities, unique qualities of both Ms. Colley-Perry and Ms. Chandler, and the mobilization of health professionals into community work and diversity representation within healthcare. Some of the profound quotes that we discovered in our interviews are listed on the poster, and our legacy report will describe the organization, contain the themes, pictures, and display some of these quotes to show some of the unquantifiable impact of this organization. Our next step is to develop the document into a booklet that can be then used for fundraising and marketing purposes.
Thanks to the advocacy of Yes to College, in 2015, Senator Pan designated August as African American Women's Health Legacy Month in the state of California to preserve the legacy of African American families for generations to come and to commend the efforts of those individuals and organizations who endeavor to work together to promote and improve the wellness of their families and increase awareness and understanding of the legacy of wellness.
We would like to thank Dr. Jan Marie Garcia, Dr. Jennifer Holt, and Dr. Laurelyn Taylor for this opportunity, and most importantly, Ms. Sharon Chandler and Ms. Toni Colley-Perry for their generosity and mentorship. We would now like to open it up for your questions. Thank you.
That's fabulous. Thank you. Thank you so much, Gina and Nicole. And I just want to say it was just an honor to serve this organization, and Gina and Nicole did a great job. Actually, Yes to College works a lot with UC Davis, with the School of Nursing, with the School of Medicine. They make us look really good out in the community. So it was really wonderful to be able to give back in this way and to present them with documentation of their legacy in the community. They're working all the time, they're writing grant proposals. It was an honor, and Nicole and Gina did a great job of illustrating their impact in the community. Dean Harvath has a question. This partnership is important to the School of Nursing and our community. How can we ensure that this partnership is mutually beneficial?
I don't know if I'm the one to answer that.
Yes, please, Nicole.
Was one of their donors, two of their donors, then when we spoke, including the California Endowment, had said that one of the reasons they contribute financially to this organization is that there is such a high impact yield for the work that they do, that these two women do more with less money than most of the bigger organizations that they contribute to. And I think right now, because so much of what they do is simply a labor of love, and as a result has these wide-reaching effects into the community, that I think almost right now, just encouraging their own financial growth in how they're able to mobilize their resources and provide resources for other people in the community.
Fabulous. Wanted to mention too that Nicole and Gina had the privilege of witnessing and learning about the tradition of older African American women being involved beyond the time that their kids are growing up in the community, and really giving back and mentoring and lifting up communities and families. So that was neat to watch in operation. Let's see, do we have two? Deb Bakurjian wrote again, do you have suggestions for how the school can continue to support them? Gina, do you have any ideas about that, or we should probably sit down and think about that as well as a school?
I think just to continue a partnership and maybe inclusion in events that are held that can involve students and involve this organization that works within the community, and just to keep that partnership open. I think that that's something that would maybe take a little more time to really think about a really great answer to that.
Thank
The,
you.
the majority of their work is through events. And so I know they will always be in need of event spaces that are often creative, out of the box, inclusive, accessible. And so I can, at least off the top of my head, I'm sure event space will always be a need. And student support. There's so much that they do that they don't have the time to really quantify and create pre and post surveys and the things that we know in academia can really bolster an organization. These women are just too busy doing the work to do the things that show academically the power of the work that they're doing.
Thank you so much. Thank you so much, Gina and Nicole, for presenting this project. Next up is Bianca Alcouture, Anna Dupre, and Linda Wong, and they have worked with Wellspring Women's Center.
Hi, my name is Bianca. We had the honor of working with Wellspring Women's Center, and our project is titled Through Her Eyes, Photo Voice at Wellspring. So Wellspring is a day center located in the Oak Park neighborhood that serves over 200 vulnerable women and children every weekday. They provide a unique combination of services, including a safe space, warm meals, arts and crafts classes, safety net services, and community access services. The center is solely operated through the work of volunteers, and this is why we knew we had to do something to honor the people that selflessly give their time to help the women and children of Wellspring. Originally, we wanted Wellspring clients to take photos with or of the volunteers, since capturing their perspective through photographs would be very meaningful and have more impact both on clients and volunteers.
And so a little bit about Photo Voice. It is a qualitative participatory research method that is a combination of grassroots social activism and photography. And it is used primarily for needs assessment. The three main goals of Photo Voice are to enable people to record and reflect on their community strengths and concerns, to promote critical dialogue, and to reach policymakers. Photo Voice is very empowering for participants because it allows them to control the perspective of their story. Photo Voice was originally used in the 70s, and the first participants were rural women in China, and they took pictures of their everyday activities. Photo Voice goes beyond conventional role of needs assessment because it invites the people to become advocates for their own community's well-being. And Photo Voice is based on the belief that the images that we see influence our focus and our worldview, and that how someone is represented helps determine who they become.
So we wanted to combine two needs that we identified. First, Janelle Smith, the executive director of Wellspring, mentioned that she had wanted for a long time to start a photography course because there are many arts and craft courses that are offered at Wellspring in addition to their other safety net services such as breakfast and lunch every weekday, translation services, a diaper bank. It goes on and on how much they do for this community. So that was one thing that they were looking to offer and had just never had the opportunity to. And the other thing was they were looking for a way to refresh their volunteer luncheon, their annual luncheon to honor the volunteers. They wanted something new. And so we wanted to combine those two things. And that's why we landed on this Photo Voice project. The idea initially had been, like Bianca mentioned, for the clients to take photos of the volunteers and just things happening around Wellspring, and to make a kind of a yearbook that the volunteers would be honored with at the luncheon. But because of what's been happening with social distancing and COVID-19, we instead adjusted the project to become a kit, a ready to go Photo Voice kit where we included digital cameras, batteries, chargers, a photography manual, a manual to use the cameras we provided, and a manual explaining how to use a Shutterfly website that we set up so that all the pictures could be archived. Our hope is that Wellspring is able to conduct a photo voice project to honor the volunteers in the near future because of all the wonderful work they do. Janelle, the executive director, is the only full-time employee there. Otherwise, everything else is run by volunteers. In conclusion, we'd like to thank Dr. Jan Murray Garcia, Dr. Jennifer Holt, and Dr. Laurelyn Taylor for all of their support through Community Connections for this last year. And most of all, thank you to Janelle for all of her support, for welcoming us to Wellspring and giving us the opportunity to really get to know her, her organization, and her clients.
Oh, that was wonderful. That was just wonderful. I know we'll have some questions. In the meantime, let me say that I am too enthusiastic and I was supposed to hand this over to my ETA, Jennifer Holt, so she'll do the next two. But in the meantime, are there questions for Bianca or Anna or Linda? A special project. Lori Nicolaisen asks, if you are able to support Photo Voice at Wellspring long-term, how would you best do so?
So this was designed to be a long-term ongoing project. So we set up a Shutterfly account and that can go on in perpetuity where the different projects can be stored. We also printed manuals that can be used around organizing the Photo Voice kit. This project was designed to be able to be used over and over again for several years.
Fabulous. Thank you. Other questions? Jennifer, I'm going to let you come on and make comments on this. You were the one supervising these students and reading their journals weekly about their experiences and learnings. In the meantime, come on, Jen, you're the one asking the question appropriately. I'm signing off to Jennifer Holt now.
Okay.
Thank you, Jennifer.
Thank you, Dr. Murray Garcia. I did want to ask you all if you could describe your time that you were able to visit Wellspring and get to know the women and the volunteers prior to the social distancing order for COVID. Were you able to assess the reception from the women for participating in such a project, a Photo Voice project of them taking photos of other women there and the volunteers? Can you talk about that a little bit?
Not this project specifically. We did on a couple of different occasions get to meet a lot of Wellspring clients and talk about with different women the different types of activities they participate in. There's a lot of different art and wellness programs. So we definitely felt that this would be a good addition to what they're already doing. But by the time we decided to move to this kind of project, COVID was in full swing.
Okay, great. Yeah, I know we chatted about that a little bit many months ago, and that's one of the considerations of taking on such a project as Photo Voice, which it's just a wonderful methodology that I've enjoyed reading about. And but to assess the reception of those participating, how do they feel about doing that? So thank you very much. I don't see any other questions, so we'll go ahead and move to the next group. I will introduce the group representing Sacramento Food Bank, and that is Michael and Dana. Oh, or maybe we'll do, there we go.
No, we're gonna do it, Jen, as soon as I can figure out. I need to get to, there's a little technical difficulty, so.
No problem. And as you mentioned earlier, we have been partnering the Betty Irene School of Nursing for this course specifically since this class was developed a decade ago. So longtime partner, and the group will tell you a little bit more about it, but the food bank provides many services for folks in the Sacramento area beyond food and other supplies. Would you like me to pull up the presentation, Dr. Jan? I'm sorry, are you muted, Dr. Jan? I can't hear you. Let me go ahead and pull up the food bank. So I'm going to share my screen if that works. Can you all see that? Michael and Dana, are you ready to take it away?
We're ready.
Yes.
Whenever you're ready, go ahead.
Good afternoon. We had the pleasure of working with the Sacramento Food Bank and Family Services, the largest nonprofit provider of basic human needs in Sacramento County. The mission of the organization is to support the poor and working poor move toward a path of financial independence and self-sufficiency. The Sacramento Food Bank and Family Services also administers resettlement services for refugees from Afghanistan throughout their first 90 days after arrival. This is a critical community service because the Sacramento area receives among the highest number of Afghan special immigrant visa holders in the United States. This population of immigrants received a special immigrant visa by serving the United States military or government back in their home country. The Refugee Resettlement Program provides the families with furnished housing, food, clothing, household needs, access to community resources, English as a second language classes, and job training. We work directly with the organization's Office of Refugee Resettlement Services, which provides support for special immigrant visa holders from Afghanistan. One particularly challenging aspect of resettlement is the process of helping the refugees set up and access healthcare services. Our healthcare system is profoundly different from what Afghan immigrants have experienced, so volunteers have to assist refugees understand and access healthcare. Refugee resettlement volunteers meet with refugee families in their homes to help them obtain medical insurance and walk them through the United States healthcare system. This includes choosing medical and dental providers, learning healthcare terminology, accessing healthcare services, and organizing their personal, medical, and insurance information.
We designed our project with assistance from staff at Sacramento Food Bank and Family Services, including Genevieve Levy, the Director of Family Services, and Rocio Gonzalez and Miranda Duncan. Rocio is the Manager of Refugee Resettlement, and Miranda is an AmeriCorps volunteer. The project was an extension of previous Betty Irene Moore School of Nursing students who had the opportunity to work with the clients and to perform several home visits with refugees and to learn the role of refugee resettlement volunteers. With their guidance, we created a training manual for volunteers to promote professional service delivery and improve healthcare usage for Afghan refugees. In addition to the manual, we made a pamphlet for clients to have quick access to key healthcare terms and a worksheet for clients to organize their personal health information. Volunteers review the manual to learn how to prepare for and conduct the home visit. The manual reviews important healthcare knowledge that they will have to teach the clients, such as healthcare settings, types of healthcare practitioners, Medi-Cal eligibility, choosing medical and dental providers, obtaining emergency and non-emergency transportation, booking an interpreter, and patient legal rights. Volunteers ensure clients have chosen providers and booked initial appointments prior to conclusion of the visit, since clients must receive their first initial medical care within the 90-day resettlement window. Sacramento Food Bank and Family Services is committed to improving access to critical health services for our Afghan refugee neighbors. Our goal was to help volunteers and refugees have a smoother visits and to ensure refugees receive a standard, thorough introduction to the U.S. healthcare system. Due to ongoing circumstances surrounding COVID-19, refugee entry into the U.S. is on hold. Refugee Resettlement Services plans to begin use of the training manual when immigration resumes. We look forward to feedback from the volunteers and are grateful for the opportunity to have worked with this remarkable agency. We would like to thank Genevieve Levy, the Director of Family Services, and also Miranda Duncan and Rocio Gonzalez for all of their guidance. We also want to thank the students from the previous cohort, Laura Butler, Jessica De La Pena, and Kimberly Tamanowska, and for helping us understand what they learned throughout their home visits, and also Dr. Jan Garcia, Murray Garcia, and Jennifer Holt, and Laurel and Taylor for their guidance throughout this process.
Hey, thank you so much. Can you, while we're waiting for questions to come in, can you both talk about a little bit more the history of how this has been built upon previous projects that the different students and cohorts at the Betty Irene Moore School of Nursing has been working on with the food bank as far as Afghan refugees?
So prior cohorts have, from the MSL program, have worked with things such as finding jobs for refugees, translation jobs, and also accessing other services. Recently, there was the Master's Entry Program students who worked on doing the home visits, and they had a lot to sort out, which helped us with our project. But these projects have been ongoing with this organization for 10 years. And I think since 2015, we've been working specifically with refugee resettlement.
Wow, that's great. And can you tell us again, if I missed it, I know that it's a big number, but the number of Afghan refugees, specifically political refugees that come to the Sacramento area?
Annually, it's about 4,000 refugees. This food bank is one of 5 agencies that helps with resettlement, and that is a program through the federal government.
Mm-hmm. Thank you. Let's see, I think we... Okay, we've got another question for you from Dr. Harvath. Who are the volunteers and how did you determine their learning needs?
That is an excellent question.
That is.
Michael?
Sorry. Is it okay if I was going to say, we actually have not been able to meet with the volunteers due to one of our plans for the project was for us to go on a home visit before the COVID-19 pandemic, and we were not able to do that. So we didn't get a chance to actually meet with any of the volunteers. We were able to meet with our mentor, Genevieve Levy, and also Rocio Gonzalez, the manager, and Maria Duncan, a volunteer. And so we were able to meet with them and talk about what some of the needs of the volunteers were. But we were planning on actually going on a home visit and we weren't able to do that. So we're hoping that moving forward, when the organization uses the training manual for the volunteers, that they can assess to see what other needs they will need to add to the training manual.
Mm-hmm. I think there's one other thing that's significant is that their volunteer base are not medical professionals. They are people from the community who are working with refugees. So they themselves may not have a whole lot of knowledge about how to access these services. So it really has to walk them through everything, including how to obtain their Medi-Cal, what to do after they get their card. So the manual kind of goes through all of that with the idea that whatever their knowledge is, this is what the organization wants them to know.
Mm-hmm. Thank you. And just to clarify, these volunteers are some of from the same pool of volunteers that may sign up through the food bank's website. There's all different kinds of jobs that they can do, such as sorting clothing from donations that the food bank receives, food, giving food to communities. And then also, I remember when I met with Genevieve Levy the first year that I was working with this organization, she said, there's jobs that people needed to go pick up Afghan refugees at the airport in a van. And so this is just one of the different volunteer opportunities, correct, Michael and Dana? Just like as there are many other opportunities they have for volunteers.
Yes.
Yes, they have about 9,000 volunteers annually. So it's a very large organization that provides so many critical services for our area.
Right. Okay, great. Any other questions? I don't see any. Okay. Well, thank you so much. This is such an important service, and it's been a privilege to be able to see these different projects, especially focusing on this one population over the last few years. So we'll go ahead and introduce our next group, Mutual Housing. And I will go ahead and pull that up. Bear with me 1 second here. Okay. Is Maria, Mary, and Felix in the house now? I will turn it over to you to talk about your project with Mutual Housing, another partner that we've been working with for several years. You can start whenever you're ready. See, I can see Mary, Maria, you're muted. And Felix, there you are.
Hi.
There we go.
Good afternoon, everyone. Since November 2019, our group has had the honor of partnering with Mutual Housing California. Mutual Housing is a local nonprofit organization developed in 1988 that provides permanent and affordable housing for individuals and families. They emphasize building communities through resident leadership and participation. The physical design of each site also contributes to community building. For example, one community consisting of families with children had homes connected to each other, enclosing the courtyard wherein you'd find the play area, community gardens, and basketball courts. Individuals inside the homes can simply peer out their window and take notice of what's going on outside. This could promote a sense of safety and connection as they familiarize themselves with those living in the same community. Our project design included organizing focus groups entitled Community Conversations and inviting residents to participate via flyers and word of mouth. We ended up conducting 2 focus groups and 1 key informant interview due to the COVID-19 pandemic with residents from 3 of the 18 communities with the goal of exploring how residents define sense of community.
Our focus group questions were based on the research we did on the sense of community. The brief sense of community scale provided guidance based in its 4 main dimensions of sense of community: needs fulfillment, group membership, influence, and emotional connection. Examples of those questions are in the poster, as you can see. We used the components as a framework for open-ended questions to guide us in our focus group interviews. The questions were then reviewed by our teaching fellow and forwarded to our community leaders. With their help, the questions were translated into Spanish, Vietnamese, and Russian. Bilingual members from each community were available for translation during the meetings.
After careful analysis, we extracted 3 major themes from our community conversation: social connection, leadership, and collaboration. As you can see on our poster, in each of the clouds, we have included some direct quotes that represent each of the major themes. For instance, social connection was exemplified through the quote by one resident as feeling like you belong. To continue with the leadership theme, another resident commented that Mutual Housing taught me to become a leader. Finally, collaboration was seen through the quote, when you are a part of something. Under each theme cloud, we also included current practices at Mutual Housing, as well as recommendations of ways to promote each of these major themes.
It is further recommended that feelings of responsibility for a community remain an under-theorized and unrepresented aspect of the experience of community in current definition of sense of community. Sense of community responsibility is a theory by Noel and Boyd that took off from Macmillan's and Chavez's four-factor framework. It aims to focus further on the higher order engagement behavior that requires a greater investment of time and resources in the organization. Collectively, the patterns of findings from this study provide strong preliminary support for the distinct role of sense of community responsibility in understanding time and resource investment, as well as leadership behavior within a collaborative. Community collaboratives are particularly salient settings for investigating these dynamics, as they are voluntary settings in which participation, engagement, and leadership are generally self-motivated behaviors. Without volunteered investment and leadership, the collaborative is severely hampered in its ability to accomplish its goals or advance its agenda.
We would like to express our sincerest gratitude to Mutual Housing, in particular our site mentors, Fernando Sobran, Courtney Cool, and Anne-Marie Flynn, as well as our community builders from our 3 selected sites. Finally, we want to also thank our professors, Dan-Marie Garcia, as well as our class TAs, Dr. Laura Lynn Taylor, and especially Dr. Jennifer Holt for all their guidance through this project. We would now like to open up the floor to any questions you may have.
Great job. I have to tell you, this group had to kind of switch gears, and kind of halfway through the year in this course, they were originally asked to do something a little bit different and probably something a lot simpler. And they took on the challenge of doing focus groups, and they got it together and did the 2 focus groups really quickly after they were asked. And I think they were both done in the month of February. And that last group, they had to switch to the key informant interview and do that virtually because of COVID, but they really got to work, and I think had an enriching experience being able to develop an interview guide and conduct focus groups for a project like this. Let me take a look at the questions coming in here. Can you say more, Mary, Felix, and Maria, about who uses these mutual housing sites? So perhaps the question is, who are the residents?
Do you mean like demographic information or?
Sure, and I know that they're all a little bit different, so perhaps you can just talk about the 3 that you did your interviews at.
Yeah, so each site, like you just touched on, is a little different. There tends to be certain ethnic groups that are more populated in certain sites than others. I actually did grab some demographic data from their website. 17% of their residents are Slavic, 12% are African American, 30% are Hispanic, 19% are of Asian descent, 27% are Caucasian, and 1% is American Indian or Alaska Native. So as you can see, they have good representation of almost every ethnic group. In order to live in one of their community sites, you do have to make under a certain amount of money. They don't have a set limit on their website. It is just kind of dependent on the person if they apply.
Okay, great. And were there any surprises that you learned while doing the interview, something that you hadn't expected?
Well, I could speak for that. During the interview process, actually, I would focus on the last identified person that we had to interview for the Norwood community. So this person actually was a totally homeless person, and he had nobody. He was living in the streets, no roof to live under. And the only reason that he was able to get an accommodation is because of a friend who actually encouraged him to come and seek some help. And he did. And because of that, he was given a roof to live under, and he was provided. He didn't have anything. So the community actually helped provide him food and everything that he needed at that time. And because of his passion for leadership, the group members within the community actually recommended for him to actually step forward and become a leader of the community. And now he is the spokesperson of the community, and he has been sent to a lot of leadership training that was actually funded by the community. And now he is one of the identified leaders of that community. And this is something that's very, very surprising for me that, like things like this actually happen, and that people are given opportunities, or in a little thing that they can actually shine and become leaders in their communities.
Wow, what a beautiful example. Thank you, Felix. One more question for you three. Were there any negative themes that emerged during your interviews, or were they all positive?
I can answer that for us. So one of the sites in particular, they talked a lot about what they felt was lacking in the community and offered some ways to improve it. One of the big themes that was revolving around that conversation was feeling frustrated that their voices weren't heard. For example, they have, each community is different, but they have at the very least monthly to quarterly resident meetings that is conducted by the leaders of the community as well as any participants that want to attend. And over time, they found that the participation rate lowered as they felt that, they come in with suggestions, the leaders take in the suggestions, and then nothing happens afterwards. And that contributed more and more to the frustration and this feeling that, well, even if I had something to talk about or wanted to bring up a concern, it's not going to go anywhere. So that was a really big thing that they felt deterred from their sense of community and the participation of everyone just feeling connected to each other.
Mm-hmm. Thank you for that, Maria. I'm sure that's, as we know, negative cases are just as important. I'm sure Mutual Housing appreciated that information and your findings as well. Well, I don't have any other questions for you. So I am going to turn it over to Dr. Laura Lynn Taylor so she can introduce her first group.
Thank you, Dr. Holt. I'm going to wait for Dr. Jan to pull up the slide, but our first group, just so you guys know, next up is Joshua's house. And like Mutual Housing, they had to kind of switch gears, or no, it's Mutual Housing, yeah, switch gears in the middle of the quarter and develop a new plan, and they did so with extreme grace. So I'm very happy for them. They were able to do that. As an excellent group to work with. So we'll just wait for the poster to come up. And Dr. Jan, I don't know, can you put it not in presenter view so we can see the full thing? I don't know if that's possible, or I can share it. There we go. Can you put it in slideshow? Just not presenter. Or do you want me to share, Dr. Jan? I have it booted up. There we go. Open the back one. I think if you go back, it's 7. Okay. Oh, not working. So I'm going to introduce you guys while we get this slide opened up. So this group included Raina Portillo, Craig Duckworth, and Jennifer Sud Bronstatter. And Jennifer, I'm sorry, I had to practice your last name since I didn't know how to say it. So hopefully I said it correctly. And they worked with Joshua's House this year. And Dr. Jan, do you want me to just pull it up? It's on my computer ready to go. Okay. Great, here you guys go. Take it away, Joshua's House.
Thank you. Hi, we had the pleasure to partner up with Joshua's House, and I would like to introduce you to our project that is very dear to our hearts, Friends Until the End of Life Doula Project. On June 26, 2019, the Sacramento Bee reported the Sacramento County unsheltered population had increased to 5,570 people, the highest number ever recorded. Sacramento has about 36 homeless people per 10,000 residents, and an alarming 59% of these individuals have been homeless for more than a year. Even more concerning, when these individuals are terminally ill, they do not have a place to go where they can die with dignity. No one should have to die alone on the streets. We partner with Joshua's House, a hospice house for unsheltered people in Sacramento, set to open later this year. Their mission is to end the tragic history of vulnerable people dying on the streets of Sacramento by providing supportive comfort for and restoring the dignity of terminally ill homeless men and women. The founder and president of Joshua's House is Dr. Marlene Von Friedrichs Fitzwater. Her grandson Joshua died on the streets of Omaha, Nebraska at the age of 34 after a long battle with substance abuse and homelessness. She was very close with Joshua and has since made this project her mission in his honor.
Joshua's House will eventually house 20 residents and provide a home-like setting where residents will have access to things such as art and music therapy, writing as healing therapy, shelter, meals, clothing, and compassionate care. Local health partners Sutter Health, UC Davis Health, Dignity Health, and Kaiser Permanente will provide hospice care, and Goodwill Industries has generously agreed to cover the administrative expenses for Joshua's House. We met with Dr. Marlene to learn more about her, Joshua's House, and her immediate goals and mission for us during our time with her. The organization is currently in the process of creating and organizing the administrative documents that are required for licensure. Along with the construction of the physical space, more fundraising is still needed before Joshua's House can open. Originally, our group was asked to create an end-of-life doula training manual, but as most of us know, plans change, and we were asked to instead create a policy outlining the qualifications, roles, and responsibilities for the end-of-life doulas who are to volunteer at Joshua's House.
According to INELDA, also known as the International End-of-Life Doula Association, which is the organization in charge of training the doulas for Joshua's House, doulas provide emotional, spiritual, and physical support at an intensely personal and crucial time. They assist people in finding meaning, creating a legacy project, and planning for how the last days will unfold. Doulas also guide and support loved ones through the last days of life and ease the suffering of grief in early stages. At Joshua's House, they will also physically help residents with personal care services. In our quest to create this document, we gathered information and example of volunteer rules, regulations, and policies from other hospice programs and from INELDA, and used these as templates to create a policy specifically for Joshua's House. We realize that things are constantly changing and that documents need to be updated. It is our hope that this will be a living document and designed in a way that makes it easy to edit as the organization deems necessary as it moves into the future. It is our intention that the policy we helped create will be distributed to each doula during the orientation and will be reviewed with a member of Joshua's House. Each volunteer will then sign a copy of the policy indicating they have a clear understanding of the roles and responsibilities of the position. It was such a pleasure getting to work with the wonderful people at Joshua's House. Their passion for this honorable mission is contagious, It is important to note that when Joshua House opens, they will be the first hospice facility for unsheltered individuals on the West Coast and only the 8th in the whole country. We need more facilities like this, as unfortunately the unsheltered population continues to grow. We'd like to thank Dr. Jan Marie Garcia, Dr. Jennifer Holt, and Dr. Laura Lynn Taylor, in addition to Dr. Marlene von Friedrichs Fitzwater. Thank you so much for all your attention, and we'd love to answer any of your questions. Thanks.
Nice job, group. And again, just so proud of you guys for switching gears in the middle and really just taking this on in stride. I'm going to ask the first question because I know we've talked about this and I have to ask. I know you said that they're close to their funding, and obviously the opening is delayed due to our COVID situation, but how close are they to their funding, and what's kind of needed for Joshua's House to get open and running?
I can answer that question. They're currently funded, 77% funded for this project. So they're short, and it's all through donations. They host different events. Major event was done last December. It's a gala that they have. So that's how they get their donors and participation. So through donations is the main reason. And I think Jennifer, is it the mayor of Sacramento as well?
Yeah. They are lucky that they have partnered with, or not lucky, but it's such a meaningful cause that they've been able to partner with a lot of community members, including local politicians. I believe the mayor was at the gala as well. And the money that they're raising right now, just specifically, is going towards the building of the physical facility. And so they have donations in place for once the facility is up and running, but it's really getting to that place where they can fully build out. So
thank you. And then our next question is, will they be hiring any RNs at Joshua's House?
To my knowledge, no. The medical staff is going to be coming from the individual hospice programs. So if you were to have a hospice in your home as a normal homeowner, then the hospice from your medical facility would come to your house to provide the hospice care. Likewise, this is a house for terminally ill patients. So the hospice members are going to be coming to them here as opposed to a privately owned facility. Does that make sense?
Yeah, which is the partnership that they have with the local hospitals, UC Davis, Sutter, and Kaiser. So those nurses, hospice nurses, will be coming from these facilities if the patient is in this hospital.
And then can you just briefly say, once this policy is in place, did you ever discuss how you would evaluate its efficacy, or how the friends feel about it, or if they feel prepared following the policy implementation?
Being that this is a new organization that's just starting, we used kind of the best resources we could to come up with what we thought would be a good policy. I think once things get up and running, it'll be important to sit down with the volunteer doulas and see what's working for them, what maybe needs some more clarification, so that the volunteers in Joshua's House can kind of fix the kinks that might be in the policy right now.
Excellent. Thank you, Craig. And thank you, Joshua's House. That was incredible. And again, thank you for your work with this agency. And I look forward to their official opening. So our next group is a 4-H. And I don't know if Ollie and Laura are ready to go.
We are. We're all set. Can you hear us okay?
I can. And it's good to see you two together. So I'll let you take it on.
Hello, my name is Ollie Baruman, and this is Laura Juarez. And over the past 3 quarters, we have been lucky enough to work with the Sacramento 4-H, an American youth organization that has existed for over a century. Their symbolic 4-leaf clover embodies the organization's mission to engage youth to their fullest potential by honoring the pledge, the 4-H's head, heart, hands, and health in service. They have a strong emphasis on developing young leaders, encouraging them to learn by doing. We have been fortunate to have the opportunity to do just that in participation with them. With the age of traditional outreach and communication methods, the emergence of social media outlets have brought significant opportunities for nonprofit organizations to capitalize on utilizing this large digital platform to communicate meaningful relationships with their desired entities. However, even for the nation's largest youth development organization with a long-time history that speaks to their undeniable commitment to America's youth, maintaining a presence in overcrowded social media platforms can be difficult. In today's society, social media can serve as a powerful vehicle in influencing young leaders who will go on to positively impact their community. Site mentors Jennifer Hinkins and Marianne Bird requested a consultation with us regarding a social media outreach plan that would help them increase their community awareness of 4-H, share inspiring individual stories, and ultimately increase their youth participation. Our goal was to assist our site mentors in exploring and creating a social media outreach plan that will serve as a resource for the community connection they have envisioned for their specific 4-H branch. Firstly, challenges that we pointed out with creating our project included the broad scope of 4-H programs, the number of paid staff, and their budget. While 4-H is made up of multiple unique programs for their youth, the scope of activities and projects can be difficult to package into one 4-H image. Additionally, the number of paid staff in the office that can contribute to the daily commitment that social media requires was limited. With all these obstacles in mind, we quickly realized that our plan needed to fit the available resources for the organization.
To kick off our project, we started by data mining the organization's Facebook and Instagram, analyzing characteristics of highly engaged posts as well as popular hashtags. We reviewed 206 posts over the last 2 years on the organization's Facebook page, and on Instagram, we collected popular, relevant hashtags that could potentially aid in making content more discoverable. We put together a list of commonly used 4-H hashtags, popular Sacramento hashtags, and best hashtags for likes in 2020, and then collected numbers of how many posts use those hashtags to date to show how far-reaching hashtags can be in the online community. On both sites, one standout observation we made was that the commercialized 4-H photos received less engagement from audiences, while photos of the actual branch members received more. These posts showed candid shots of youth and volunteers at summer camps, seasonal events, in collaboration with local businesses and other 4-H branches. We also offered our outside perspective about their varying mission statements. Through data mining, compiling, and analyzing highly engaged posts, we were able to package significant trends that could potentially help the organization fulfill their goals. We presented our findings and information through a brief social media outreach plan that contained a current social media analysis, implementation strategy, and timeline. While the effectiveness of our project cannot be determined in such a short amount of time, our hope is that our tool will guide leadership's efforts toward growing their brand and creating engaging content that will potentially and eventually increase youth enrollment in their programs. In the future, the organization has plans to align their mission statements across their social media sites to encompass a more unified overall picture of 4-H and create a committee powered by youth to manage their social media posts. Thank you for your time and attention. We're ready for questions if you've got them.
Thank you, Laura and Ollie. That was great. And I just want to mention to the group that here are two people who had never done, to my knowledge, data mining for social media and just took this on in stride and did an amazing, amazing job. And I think hopefully created a really valuable product. So our first question comes from Dr. Harvath, and she asked, has this progress influenced your personal or professional use of social media?
Oh, that's a really great question. You know, part of the challenge that Laura and I had is that both of us actually aren't very social media savvy. So it was a particular challenge for us, but in the end, we actually found it to be not only useful, but a lot of fun. And we really were able to see the value in what social media offers to businesses. So though it may not have personally changed like our personal social media pages, we absolutely now see the value that they can offer for any small business or organization.
Thank you. Thank you. And then I had a question. How did you go about picking these platforms versus, let's say, like TikTok, which is new, or Snapchat? Like what drove you to Instagram and Facebook specifically?
So the Sacramento 4-H actually already had Instagram and 4-H, and they were just sort of like floating out there in space. And they asked us specifically to help them with those two platforms. And so that's how we hit the ground running, was just digging into the Instagram and the Facebook that they already had up and running.
Just to add to that, I think just like looking at some of the statistics that we did, you know, as Ollie mentioned, 95% of teens in the United States have smartphones, and 72% of them between the ages of 13 through 17 use Instagram. And then we also found that most US adults use Facebook, and you know, our whole target group was youth and then parents that would both come together to hopefully be important in this outreach.
Excellent, great job, and thank you for explaining that. Any other questions from the group? Oh, there is one more, so I'll use this as your last question. Will your thesis research uses similar methodology or topics since you now have these tools?
Something to consider.
So I think people might want to hire you now, because I don't think there's very many nurses out there who know how to data mining and social media outreach. So excellent job. And it was a pleasure to work with you all.
Thank you. We had a really great time, and we wanted to thank both of our TAs and Dr. Garcia. We've learned so much through this project, and we feel really lucky to not only have been in this program, but work specifically with 4-H. It was really important to us to give them a quality project and a resource. And we've actually given a sway presentation to them with all of our information, and they've privately contacted both of us, thanking us for the value and the project that we've done. So it's really meant a lot to both of us. So thank you for the opportunity.
Excellent. Well, thank you guys for your hard work. All right. So last but certainly not least, I'm going to present our last group. This is a poster by Riza Magat and Sarah Stallings on their project with the ARC of Amador County.
Hello. Can everybody hear me?
Yes, we can hear you.
All right. Hi, my name is Sarah Stallings, and my partner is Riza Magat. We had the privilege to work alongside the Art and Recreation Center in Amador County, which aimed to foster independence among the intellectually and developmentally disabled community. Currently, the ARC presented some challenges regarding the health and well-being of the clients. In particular, the diet and physical activities among the clients were subpar. Our goal was to implement a fitness regimen, and we were able to involve the application of the Fitbit while involving the various clients, in which we were able to do last quarter. The utilization of the Fitbit encapsulated a variety of features geared toward tracking the number of steps walked, coupled with the caloric consumption and heart rate monitoring. Incorporating the use of the Fitbit with the dance-off challenge falls parallel to the anticipated outcome we want to see with the creation of this exercise and wellness program. We will now turn it over to Rita.
Hello. So what did we end up doing? The members and the staff of the ARC have shirts that says, that has a print that says, disability rights are human rights. To help address this issue, our project was aimed towards developing a fitness curriculum that the ARC can implement all throughout the year and replicated in the years to come. A health and fitness need that had been identified based on the rising amounts of clients with diabetes, hypertension, and other cardiovascular diseases is resulting from sedentary lifestyle. A fitness curriculum was developed, which included 6 activities and a fitness wheel, which is a flexible and organized tool that is both applicable for small or major events and can be utilized as a fundraising or awareness campaign. The curriculum included series of steps to safely implement each activity. The fitness wheel is an overview of what planning an event generally looks like. We have attached a QR code so staff can readily access the curriculum toolkit. What is unique for this population is that it can be challenging to stay healthy and comprehend the ramifications of poor health choices. Each individual that the ARC serves has a staff assigned to help determine a service plan that's tailored to his or her needs. Therefore, it was important for us to develop activities that are simple to understand, can provide opportunities for positive reinforcements and use of simple technology. All members of the ARC have access to devices like mobile phones, smartphones, laptops, computers, or smartwatch. We incorporated the built-in technology for whatever device they are using for activity steps and calorie tracking. So on February 27th, we implemented one of the activities, which is the dance-off challenge. It was so humbling to partake with this community through its leadership, staff, and most importantly, the adult participants of the community. Like music, dance transcends and crosses physical and cognitive disabilities. Everybody broke a sweat, danced away, and had a good time. The participants may have varying degrees of abilities to communicate, but through dance, they understood. Majority were verbalizing, they had fun, they were exercising, the dance made them sweat. Some were checking their phones to see the number of steps the activity recorded or the calories they burned. So in conclusion, good ideas do not always yield in good results, and good ideas that yield in good results sometimes require time in order to evaluate outcome and effectiveness. As already stated, the long-term objective is to envision these activities in practice, sustained, and ultimately result in better health outcomes for the participants. What we would have done differently will most likely involve more time exerted in implementing different activities that were outlined in our curriculum. So if in the future there is a way to conduct a pre and post-implementation analysis and measure health outcomes of the participant, it may validate the effectiveness of the project. To end our presentation, I would want to thank and acknowledge our 206 teaching staff, Dr. Jan, Dr. Taylor, and Dr. Holt for your unwavering support to approach and teach our communities and how we go about our projects guided by principles of cultural humility. And we want to, equally important, we want to thank our community mentors, Ms. Karen Gregorius, Ms. Kim Vinciguerra, and for their enthusiasm to mentor us as we went over our partnership with them. Thank you.
Thank you, ladies. And I will say this is the first time this group has worked specifically with the ARC. This was through a partnership through First Five Amador. So it was a really great project and great to hear about it. So I will open now for questions for Riza and for Sarah. And the first one is, how did you come up with your fitness curriculum and fitness wheel? So how did you come up with this idea?
Early on in the project, we were able to identify and narrowed our focus on implementing a health and fitness curriculum and work with existing and free health apps, because those are the needs that were identified and expressed during our needs assessment with the ARC. So our approach was multifaceted. First, we created the curriculum, which include like long step-by-step plan for each of the 6 activities. We asked our community, for approval, obviously, for the activities which to include. Our hope was for these activities to be implemented like on a small scale, or if they want to scale it up to like a fundraising or an awareness campaign. So we wanted it to make it easily accessible. So we created that QR code. So, the curriculum doesn't just get like lost somewhere in the office, and they can easily access those toolkits. And then the fitness wheel essentially is to provide a visual representation of what the curriculum included. So it has like a planning component to it, logistics component to it, staff that's going to be involved, everything that's listed on it. On each of the activity, it has those components.
Thank you, Risa. Sarah, did you have anything to add to that question, or do you want to?
Yeah, I was going to say that a lot of the brainstorming that Risa and I did stemmed from personal experience. By happenstance, I worked for over 5 years, like really close with kids with special needs and adults. And so I felt that I was able to carry over a lot of my own knowledge and implement it to this project.
That's great. So just by happenstance, you ended up in
this group. I knew.
We randomly assign people to these groups.
I know, yeah. And so I was like, oh wow, this is right up my alley.
So I'm going to just ask one last question. I'm going to check and make sure I didn't miss any. So one last question, and this is from Dr. Holt. Have they held clinics to check blood pressure or blood sugar with groups to create awareness of other health measures outside of heart rate?
So each participant or adult, person that's utilized the service of the ARC has a staff, like a dedicated staff that, that's assigned to him or her. So, but that goes onto how they're going to go about their day, their activities, identifying those needs. They do not necessarily have like a full access to their medical, background. I mean, they do have access to those because those medical issues, but they don't necessarily always check for those. The members of the ARC all have access to devices though. So like, that's why we kind of focus on something that is simple, that they can, that the participants can measure themselves. Yes.
Thank you. Yeah, that makes sense. Anything else to add? So with that, I think I'm gonna close out the session and hand it back over to Dr. Murray Garcia. Thank you both. Thank you, Sarah. Thank you, Risa. And thank you to the whole 206 class. Excellent job, guys. It looks like you're unmuted, Dr. Jan, but we can't hear you. If you type it in the chat box, Jennifer and I can read it. Sorry.
Technical difficulties.
I know.
Wonderful job, everyone.
Yeah, this is excellent, especially given the fact that, just so everyone knows, normally we would do this with posters and being in person. So Dr. Murray Garcia said, thank you to all our fabulous 206 students and another amazing year of impact.
Yes, and during historical and unprecedented times with social distancing because of COVID and now other unrest and political challenges and social challenges as well. So we thank all of you for jumping in and doing what needed to be done at the last minute at times at both your sites and also in this course, and to all of the fabulous mentors for which, if they weren't willing to be our partners, we couldn't have any of these projects or presentations take place. So it's been a privilege.
And then Dr. Jan also said, please forgive my Zoom low IQ and thank you, my fabulous TAs. And thank you, Dr. Jan, for all your mentorship over the past 2 years. It's really been my pleasure.
Yes. Thank you so much. Life-changing. This is as Dr. Jan says, and I've adopted this term, this course is not just informational, it's transformational. And it's transformed my life. And I know everyone's life that's taken this course. And it's just unbelievable that it's coming to an end, but there's going to be new courses and it's going to evolve into other things.
And you're all going to take this knowledge from this class and go out and make the world a better place and transform your workplaces. At least that's my hope.
Yes.
So if there are no further comments, I guess we can end the session and just thank you all again and be well.
I think we'll turn it back over to Jenny Carrick now.
Yeah, we'll turn it back over to Jenny.